listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in.
Hello, 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 and greetings to all who are listening to my voice. It is that time again. Tapped In, and I am one of your hosts, Zakiya Bell Rogers.
And I'm Leonard Jones.
And Leonard and I come to you from the Communications and Public Engagement Department of Buncombe County, better known as CAPE. Leonard, who do we have with us today?
Today we'd like to highlight the Nurse Family Partnership Program with Buncombe County's Health and Human Services. So joining us today is April Baur, Veronica Watts, and Claire Fontana.
All right.
Welcome, April, Veronica, and Claire.
Thank you so much. Thank you. So, to kick this show off, I would like for everybody to give our audience a little bit of information about you so they know who they're listening to. And we're going to start with April.
Okay, hi, I'm April, and I'm the supervisor for the Nurse Family Partnership team at Buncombe County.
I'm Claire. I'm one of the nurse home visitors on the team at Buncombe County as well.
Hey guys, I'm Veronica. I'm the office assistant. I've been with NFP for about 7 years. So my job is to support the nurses and the supervisor as they work with birthing parents throughout the county.
Okay. So are y'all from Asheville or are you transplants?
Transplant, yep. Moved here in 2015. Most recently, before this, was in Salt Lake, but we are here to stay.
Yeah.
Transplant as well, but I did come down in 94 to go to college, and I've pretty much been here since, so it's been a while.
Same for me. This is Veronica. Moved here from school 2006, but not far away, just from the Piedmont of North Carolina.
Okay. Well, what is NFP? You know, we hear so many acronyms. And so here's another one for your books, folks. So what is NFP? And anybody can take that one.
Sure. So NFP stands for Nurse Family Partnership, and it's a community health program. It's evidence-based. We actually have over 45 years of research proving that it works. And basically, it's a partnership, as in the name, right, between specially educated nurses and moms or birthing parents. We try to start early on in the pregnancy and work with families until the child's second birthday. And it includes regular home visits and allows for the relationship between the nurse home visitor and the mom or parent to develop over about 2.5 years.
Mm.
So what's the goal of Nurse Family Partnerships?
The goals are to improve pregnancy outcomes, so partnering moms, like getting them connected with preventative health practices, making sure prenatal care is happening through providers, being able to support moms and birthing people to, make small changes if that's what's needed. We're here to help improve child health and development, so assisting families, providing competent care, teaching about development, teaching about ways to encourage your child's growth and development. We're able to weigh and measure babies, so checking in on their growth. We also, there's a piece of improving economic self-sufficiency for the family, so providing parents to develop a vision for their future, planning for additional pregnancies, continue their education, find work, maybe connecting with childcare as needed that's supportive. And really the main focus is partnering with clients to follow their heart's desires to reach their own personal goals. So the relationship just helps these goals kind of come to fruition sometimes.
And that's so awesome that you have this program because you're helping moms because the thing is people think that's what women are supposed to do. They're supposed to be moms, and they think once you have this baby everything is here you go. No, and so you all come in and you're there to help guide folks. So can you give us an example of what a day would look like if you were working with someone?
Yeah, so I'm one of the home visiting nurses. There's 8 on our team. Well, 7 we're hiring. There's 8 on our team right now. And so, once you get to your full caseload, you're working with 25 families. So, takes a lot of people you're sort of keeping up with. Visiting every few weeks, so showing up at their home, maybe having a plan of something, I want whatever they want to learn about. So, a mom wants to talk about, how should I feed my baby? I want to breastfeed. What does that mean? So being able to provide education and information, being able to, just provide information. We're nurses, so we're doing assessments, we're checking in on blood pressure, checking in on weight gain, checking in on their symptoms, like, oh, you have a new headache and your blood pressure's going up. Let's get you to let's call the OB right now. Also, so we're driving all over the county, we're visiting with families, there's families I've seen at home, families I'm visiting with at McDonald's, or, sort of wherever, meeting clients where they're at and what works for them.
And so many people focus on during birth, the pregnancy and during birth, and after that, it's like, all right, here's some Band-Aids and some pads, and you can have a great day. But we know there's so many things that happen after, and you said blood pressure and headaches. People think, oh, I'm not sleeping, or, oh, I'm tired, or, am I drinking enough water? And so it's so good to have an extra voice to say, hey, you know what? This may be something else. Let's check in on it. These are the things that could be happening. Because we do know women, not only is it dangerous during birth, but afterwards, a lot of women come into some complications. So, all right.
That's really one of the two key things that I love about this particular program. When I talk to working parents who have been referred to us, and I'm that initial contact, two of the main things that I focus on are that long-term support. A lot of our support for new moms falls off at 6 weeks postpartum, 8 weeks postpartum. So the ability to continue to see someone up until that child's second birthday who is going to know your history, who's going to know if you had issues during pregnancy. If you have a toddler who's being picky with food, that nurse is going to know if you had issues with formula or breastfeeding. You're not going to have to fill them in on things. That relationship, it just really is key to long-term care, to really helping our families in Buncombe County feel supported.
Yeah. And support is so important. Leonard?
So one of my questions is, how do people participate in this program? How do you enroll, or what's your target audience?
So for a lot of times for Nurse Family Partnership, if you're looking at our national or international partners, you'll see information about first-time moms. And that is the original idea for the program. However, in Buncombe County, we are able to participate in enrollment of moms who are on second, third, fourth pregnancies, which is fantastic. So if there's a mom who had issues with previous pregnancies and has risk factors, we are still going to be able to enroll her and work with her. We do enroll moms during pregnancy. Ideally, by 28 weeks, we really want to go ahead and be involved with the family before the birth. As far as demographics, we have moms from all walks of life. We have moms who are young teens. We have moms who are in their 40s. We have moms of different races. We have moms of different languages. We are always happy to work with interpreters if it's not a language that one of our nurses speaks. Anything else from April and Claire to add to that?
Yeah, mainly to qualify, you would have to be enrolled in WIC or Medicaid, so there are some income.
Yeah, you don't necessarily need to be enrolled, but you do have to qualify for that. So even if a family, for example, wanted to get food stamps and found out they were going to get $3 or $4 a month and said, well, that's not worth doing the paperwork. Because they qualified for that, they would still qualify for us.
Yeah, I think the kind of overall idea is that we're looking at supporting families who are most impacted by social or economic inequality.
Hey, so I know you all have had 45 years of research. That's way longer than we've been here, Leonard. So they've been doing this a long time. And so what are some of the things that have been shown throughout this research?
Well, I think that we have a lot of good outcomes relating to the things that, you know, Claire talked about as being the goals. So that's related to improving health during pregnancy, improving health for children, and, you know, really connecting families to resources. So if we do have a family that we're working with and the child maybe has some developmental delays, the nurse home visitor can be one of the first people to pick up on that and be able to refer them for intervention at an earlier age. And then the piece around the economic self-sufficiency, I think we also have good data to show that the relationship between the parent and the nurse home visitor really supports families in reaching economic self-sufficiency. We can help link them to housing, for example, or working with them on workforce opportunities. Childcare, I think Claire mentioned as being an important part of that sometimes if families are interested. So yeah, I think maybe one of the things we're going to talk about too is, you know, specifically you mentioned, you know, the pregnancy related complications and things. I think a lot of times people deliver and they go home and they're scheduled to see a provider in 6 weeks, but a lot can happen between birth and 6 weeks. And so having that nurse who's, you know, coming to see you, and during that time period we do visit weekly, then we can pick up on if there are complications, if there are concerns, and address them and really help reduce complications and even potentially death.
And that is so strange to me that you have a baby, like your body goes through a significant amount of trauma. Where you go natural, have a C-section, there is a lot of trauma to the body, and it's like, I'll see you in 6 weeks. Even when you break your arm, after they do the surgery, they put the cast on. Midway before the 6 weeks is up, they come and check and make sure your arm hasn't gotten too skinny and your cast still fits, and then they send you back. But here you've had, in the famous words of kids, a whole kid. You had a whole live kid, and they just send you home, and they're like, "Hey, have a good day. Thanks for coming by." And that's scary. I mean, that's very scary because your body is going through so much hormonally and physically. And, you know, I've seen where women have talked about their legs swelling and or the fluid not coming off, or just like issues that you just don't know about. So
I had a question in terms of you had mentioned you have weekly visits with the mom, and my question is, with a primary care physician, how does that relationship with the in-home nurse, how does that work?
Yeah, so we do for some families and some clients, like if they have higher risk factors, we might be checking in more with healthcare providers. But if, you know, they do get notice that, you know, they're enrolled in this program, so, you know, we might be having to call in like blood pressures or things like that for a client, or if something seems a little off sorts, we will, or even just someone maybe like missed an appointment and can't get through. Sometimes just having like and even, you know, we have a phone that works, so I can help make a phone call, and maybe like that can be a barrier for some families, you know, that don't have access to, you know, a phone that's working at the time. So just being able to help kind of check in on that, and with pediatrician work, so, you know, and that is the thing, like they have the baby, postpartum care is 6 weeks, but they're seeing their pediatrician a lot more frequently in the beginning because, you know, all the focus now is on the baby, where the mom is still like needs a lot of support right now. Like, come on, just these things are disjointed. But with the pediatric providers, you know, being able to call in weights and length, and, you know, check in on feeding. Maybe a baby needs to get seen sooner. Like, hey, this weight gain's a little slow right now. Like, we want to make sure baby has what they need. Getting people connected, maybe if they're breastfeeding and there's questions. You know, a lot of us have lactation education, and but, you know, maybe let's get connected with WIC and with the lactation consultant specifically. You know, so yeah, so it, you know, a lot of it is sort of what's going on at the time, but I feel like we do have good relationships and are able to make calls and kind of help make things happen sometimes. Just be that advocate, be that fierce advocate.
Is there a cost or anything associated with this program?
There's not. It is for clients. It's totally free. There's no. We you know, say that you get your own personal nurse, and it is at no cost to people participating in the program.
Okay, so as we know, women of color are always, on the top of a list during medical research. So, how do you all support women of color? And what are the statistics and the things that are making you all work really hard?
Yeah, I think we definitely know when it comes to maternal mortality, it is a big, huge issue. For Black women, they're 3 times more likely to die from a pregnancy-related cause than white women in this country. And more than 80% of pregnancy-related deaths are preventable.
Wow.
So, yeah, that's where the NFP nurses, can really come in and make a difference. And Claire, I don't know if you want to talk a little bit about the training and things that we do within NFP to make sure that all of our nurses are able to best serve women of color and have that equity lens.
Yeah, I mean, it's true. The health inequities are real, and with infant mortality as well, Black infants, more likely to die in their first year of life than white infants in our community. So being there, being an advocate in that capacity, but also even taking it a step back, being able to come in, and there's a lot of training that I feel like NFP on a national level is really promoting and working towards, called the cultural consciousness pathway, which is supporting nurses to come in with a health equity lens and a cultural humility lens. So the client is the expert on her life. I might not share a lived experience, but realizing that the health systems specifically, affect these outcomes, and kind of being able to take a step back and have that education, have that knowledge. Also working with local Black-led organizations in our community. We work with doulas that we refer clients to at Sisters Caring for Sisters. Project NAF in our community, just trying to support and uplift the work that is Black-led community work that's happening to help with health inequities and around for pregnancy and postpartum folks.
Now, are you all there when the babies are born, or are you just you're up there until the baby's born, and then when the baby come home, or do you go to the hospital?
During delivery? Yeah, no, that would be really cool, but also really challenging, because I think Claire mentioned each of the nurses has 25, clients or families they're working with at any given time. So I think trying to coordinate that would be a challenge, but definitely, available, with the visits, and then also, just for kind of checking in, seeing how things are going. But we don't serve the same function as a doula who would be there, specifically during the labor and delivery process. And shout out to doulas, they're amazing.
Yeah, they are.
And we love partnering with them. So
yeah.
And that's becoming, I think, with your program and coupling with a doula, I mean, the safety net, the support in that is so amazing. I know I have a kid, and you think I'm very thankful for her. However, I wish that I could have had a doula or this program, because there were things and they use language that's not for everybody, unless you've gone to school, and you find yourself Googling it, and of course, anything on the internet, medical.
Don't Google it.
No.
Yeah.
Don't Google it. I was like, what? What is that? And so you have so many women who are left in this journey alone, and then you talk into that. And to me, I was young when I had my daughter, but according to the doctors, I was advanced maternal age, better known as geriatric. I now say geoatric. I don't know what that was, but geriatric. And so, there are so many labels you get when you're pregnant, and all you want to do is bring the healthiest little human that you can bring into the world, and you to be safe. And there are a lot of questions that just go unanswered, like women not being heard when they're saying they're in pain. Women,
especially women of color.
Yes. I can tell you the looks I got when I was like, that hurts really bad. And they're like, you're not screaming. Yeah, not appropriate right now. So the thing is, women are tasked with so many things, and no one's listening to them. You know, I always tell my husband, I would say, hashtag hear me. You know, like, you know, that's the joke we have going around the house. But no, really, like, hashtag hear women. Like, they're in this medical atmosphere not being heard.
But I have a question. I mean, sitting here as the only male and non-birthing person in the room, my question is, how do the family or the partner or the spouse help support women along with the nurse family partnership support that's coming into the household?
Yeah, that's a great question. I think that's the reason that it's called nurse family partnership is because we recognize, you know, we're not just working with moms or birthing parents, we're working with the whole family. And so a lot of times that is the partner, you know, could be the father of the baby or another, you know, supportive person. It could be a lot of times, especially if we're working with like younger clients, it might be their parents or grandparents or family members. So really, that's up to the client. I would say as to how much participation and support that they're receiving from those folks and how much they want them to be involved. But Claire, you can certainly speak to that. Those people are present at visits a lot of the time.
Definitely. So, you know, just answering questions that they might have, including them in the conversation. You know, what are your concerns? Even if we're going to talk about labor and what to expect, like some hands-on things they can do that would be helpful. Maybe some like ways to figure out how to communicate in that moment when, you know, like when she says popcorn, she really means I want the epidural or whatever it is, you know what I mean? Like, I don't know, I'm just thinking. Or families, you know, and there might be too like generational differences with like, you know, how maybe baby raising are things that you're supposed to do that maybe there's research that's showing like, no, it's maybe not the safest to do that. So like how to be that sort of voice of information, not judgmental, you know, but just being there to provide information, because that can be a piece too. And I've had the honor of being like so involved with families and partners, husbands, boyfriends that are there that just show up, or a family 4 generations deep of women in the room, and we're talking, you know, we're here with the newborn and having that experience, and that's like so cool. So bringing the families along for the journey and just validating what they're doing and how they're there and how much that impacts that baby. So
yeah, that's neat. That is so neat. I remember like hearing men talk about when their kids are born and say, okay, you see like them like being involved. And you know, I think like, I don't know how many other mothers did this, but like you're so excited about being pregnant, and then all of a sudden they talk about, well, now you need to get this kid out, and you don't think about that, and you're like, oh my God, and they give you like 482 options of how you can get the kid out. And so I'm like, this is not in the pamphlet in the front.
Yeah, that kind of support, that kind of here's something to expect. Let's create a birth plan for those community resources. Being able to have that warm handoff. It's so scary to be given a phone number, be like, here's the person you need to contact. And if you're not a competent person, reaching out to, even if it's a support, reaching out to a support that you don't know is really difficult. But if we can say, you know, this is the person that I know at this support place, and this is what they can provide you. Or like Claire was saying, making a phone call with a client, whether that's because they don't have a working phone or because they just need that emotional support. Giving that, like you said, wraparound care really makes a huge difference.
Because, you know, it's only so much that the doctor office can do. And, you know, towards the end of that pregnancy, everybody comes in and checks you. You basically, everybody on the staff, you know, checks you, and everybody. And so from going from, this is my doctor, from 2 to 7 months from, any of these people might deliver your kid. And that's really scary, but to have you all as a support, I think would be amazing for those mothers, because that's something that's consistent with them. Like, I may not have my doctor, they may be at home, they may not be on call that day. And I'm like, what do you mean? You got people pregnant, you're not on call that day. So it's like, no, we switch off. So it's like, you know, that's kind of scary. So I love that support is there. And I wish that we could extend it to more people, even if it was a fee. Because I'm pretty sure during those days, and I didn't have any dependents, so I know I wouldn't have qualified. But my thing is, if you could pay a fee to have that service, that would be amazing.
I think everybody should have
Yeah.
the support. I think you mentioned earlier that a lot of times there's this assumption that so much of like pregnancy and parenting is intuitive somehow, that you're going to just, you get this baby and you're going to know exactly what they need. And you can certainly learn to read your baby. And sometimes that's easier than other times. But I think everybody has lots of questions. And we don't want people going to Google because that's not the place. So having a trusted, support and somebody you can ask your questions of, you can just bounce things off of is invaluable.
So y'all mentioned connecting people to resources. Are there any resources y'all actually bring into the home for any of your clients?
Well, we can bring diapers and like things like that, like physical things. Yeah, like diapers, wipes. We definitely have supplies. We try to keep on hand sleep sacks and boppy pillows. To teach about breastfeeding, sleep sack to talk about safe sleep. And then we maybe reach out to the bear closet or some of the like kind of baby closet items to be able to get things to bring to families that might need them.
But then also the particular trainings that our nurses have that they can bring in. Several of our nurses are lactation consultants. There are multiple parenting programs such as Circle of Security that our nurses are trained on so that they can really get into kind of the nitty gritty of what each individual family wants to work on.
Yeah. And you all have a graduation coming up soon, right?
Yeah, so we do. We're very, very happy to be doing graduations again. Had to take a break there for a couple of years. And we're still not doing them inside of the winter. But in the summer, we have get-togethers where we honor the families who have graduated in, say, the last 3 or 4 months. But we invite all of our clients, not just our graduating clients, so that moms and dads and parents of all sorts can really connect to other parents. So that we can see those interactions. We always have some art supplies for the kids, something that they can make and take home. We do lots of photos with our graduates, and it's just a really good time to get together with other parents.
It's fun to see the kiddos get to wear cap and gowns if they choose, which is really cute. And I just graduated a family that's from the Ukraine, and they were like, saw the cap and gown, and they were like, we've only seen this in American movies. Like, they were so excited to do it. So, I don't know, it was kind of funny.
Yeah.
That is so sweet. So sweet. And it's those things that create a community.
Yeah, for sure.
And seeing other people who've gone through these programs. So not only are you having nurse family and you're, they're going on to greater things, they're learning how to create a community for themselves. They always say when you want your children, when they leave their house, to have 5 people that they could call at any time if they need help or anything that will help them. And as adults, being in these classes and things like that, they learn to have those support adults that if anything is happening, I can call these people. So that's why these types of organizations are so important.
So if someone's been listening to the show and they think this is a good fit for them and they think they may qualify, how do they contact you?
So you can talk to your doctor or WIC. We can get referrals through those places. Also, if you just Google Nurse Family Partnership Buncombe County, you'll find our page, and that has all of our contact information on it. People can self-refer. It does not have to come from a doctor or a community partner. You can call the phone number on there. My phone number is the office line. I'll go ahead and say it on here. It's 828-774-6232. That was 774-6232. But again, just Googling the information will get you everything that you need. And they're all pretty easily reachable.
And that's the only time you want to use Google.
Get it for your contact information.
Yes.
That's it.
Yes. Then you have any other questions? Because I think I just saw Mr. Randy. And how many minutes I got, Mr. Randy? Oh, he's laughing. Okay. I got 5. I got 2 minutes. Oh my goodness. So I'm going to allow everyone to leave a one thing they want our audience to know
take will you list ours up?
Sure. Yeah, I think maybe just like I said that, a lot of pregnancy and parenting is not intuitive. It's okay to not know what you're doing, and having your own personal nurse to help support you is a great opportunity. So yeah, take advantage.
Yeah, basically I will ditto that and just say, as nurses, we're here for our community. We support our community, and yeah, it's great to be here today. Thank you.
Thank you. Yeah, just building off of that relationship piece is absolutely key for what makes nurse family partnership work. We have family, we have friends, and those are wonderful places for support. But having someone who is outside of your immediate network, who can really come in with a fresh pair of eyes, who can really be that honest voice for any education or support that you may need, someone that you can build a relationship over time so that as difficult things come up, this isn't a doctor you've seen twice, this is a nurse that you have built a close relationship with so that you can really discuss those vulnerable things that arise.
And I would just like to encourage community, if you feel like this may be a good fit for someone that you know or for yourself, we strongly encourage you to reach out to Buncombe County NFP. And you always can go to buncombecounty.org for more information about the Nurse Family Partnership that you heard about today.
And parents out there, I just want to say you're doing a great job.
Oh yeah. And so I am going to go ahead and wrap us up today, and it's been so amazing. I want to give a huge thank you to all of you all for what you do in our community. And sometimes we hear the word that they're expecting, and we automatically go, ooh, they're expecting a baby. But I think there's so much that comes with the word expecting. As a pregnant mom, you should be expecting support. You should be able to expect to understand. You should expect to be heard. You should expect to have a community. You should expect to be safe. You should expect for your baby to be safe. You should expect to come home with your child. And so with that being said, I want to encourage all of us, everyone, including those who say they never want to have any kids, to go out and just look at the information and the data about women and childbirth and get involved, because we need all hands on deck, because we need moms to be safe. We need babies to make it to way past their first birthdays and become adults. And we need moms to make it out of the hospital. We all, there's so many songs about women. You have like Grandma's Hand and a song called Sadie where he talks about his mom. And I'll always love my mama. And, next month in May, we have Mother's Day coming up. And so think about all those important people in your lives, and let's do what we can to support them. Also, I want to give a huge, huge happy birthday shout out to Leonard Jones. His birthday is April 20th. And so you have until this recording, all the way till May 2nd, to call him and let him know happy birthday. And from us to you, thank you, Buncombe County. You are one Buncombe. And until next time, we're here and tapped in.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Nashville. Learn more about today's topics at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.